Today, I will be presenting on coping with anxiety and fear of recurrence. During this conference, you would have heard a lot about skin, different organs where melanoma can present itself, or perhaps some information about the brain in the context of brain metastases. I will spend a few moments talking about normal brain function in humans, so please bear with me. I think it will help us better understand anxiety and fear. I will draw your attention to two parts of the brain, amygdala and prefrontal cortex. You see, deep inside the brain, there is a little almond-shaped structure called amygdala. This is where your emotions are processed and regulated. It is part that is called the lizard brain, and it is quite primitive, and it has not changed much despite rapid cognitive development of humans. Where our brain has developed heaps is in the prefrontal cortex. It is the part that is used for planning, thinking, reasoning, and decision making. Most of the time, prefrontal cortex and amygdala have good communication unless there is some sort of danger where quick action is required. This is when amygdala takes over. For example, if you put your hand in hot water, there is really no time to debate what is the most reasonable course of action. Quick action, which is removing your hand, is all that is needed, and that's amygdala's job. Now you know two things about amygdala. Number one, it is where the emotions are processed. And number two, it has not developed much despite rapid brain development in humans. So amygdala still views the world like it did when we were more primitive, when we lived in caves and there was a real threat of being eaten by a large animal like tiger or lion. So naturally, human mind was on the constant lookout for anything that seemed threatening. Imagine what would happen if you saw a tiger or a lion approaching you right now. Everyone in this room would feel fear and anxiety, which is normal, natural response to danger. Now today, there are luckily no tigers and lions roaming around, but our amygdalas have not changed much since those times. So it still scans our environment for things that might be threats to our safety and well-being. Melanoma can be seen a threat to someone's life and well-being, so it's responded to in a similar way as to a tiger, with fear and anxiety being a normal response. So our minds and amygdalas are scanning our environment for any threats. There will be some things that we are not certain about. That shadow in the bushes, we may not be sure whether it's a cat or a tiger. Now, it is so much more helpful for our survival to assume that it is a tiger and act accordingly than to assume it is a cat and relax. If I was a cave woman seeing cats instead of tigers, I would not live long enough to pass down my genes. So it is very helpful, and in fact, I would say crucial to our survival to think of the worst case scenario when there is uncertainty. Now, this is the end of the biology lecture, and I want you to take away three important points. Number one, human emotional brain has not kept up with the cognitive development. Fear and anxiety are a normal response to threat, and it is normal to think of the worst case scenario when there is uncertainty. So how is this relevant to melanoma? Diagnosis can be seen as a threat to one's life and well-being, and we can also expect anxiety to peak during times of uncertainty. It is quite natural to think about worst case scenarios during those times. So melanoma patients and their loved ones frequently face uncertainty as they manage their melanoma. Most common times of uncertainty and therefore anxiety include noticing changes in the skin as there is uncertainty about whether the changes are benign or more sinister, waiting for the results, uncertainty about whether it will bring good news or diagnosis of melanoma or progression. Diagnosis itself is very uncertain times, uncertainty about what it means, prognosis, or the best course of treatment. Questions that arise just before the start of treatment commonly include uncertainty about the logistics, whether the treatment will work, and what side effects might be experienced. Completing treatment, uncertainty about how to resume life and how to cope with the removal of safety net or of frequent medical contact. Routine scans and follow-ups bring uncertainty about the status of disease. Symptoms of recurrence or disease progression can bring uncertainty about prognosis and response to further treatment. And lastly, when new symptoms emerge, or even when there are any changes in your body are noticed, uncertainty about what these changes mean. And since we're social animals, seeing someone else get attacked by their tiger will likely result in a spike of anxiety and fear. So, for example, when someone else gets diagnosed with melanoma, cancer, or chronic health condition, when you hear of someone else's disease progression, and even when you hear news stories about melanoma or cancer. So for majority of patients, anxiety and fear are normal. They increase at times of uncertainty, and then they decrease once there is more information. The warning signs that fear or anxiety are of concern include experiencing them all day, most of the days, feeling unable to engage in other activities as thinking about melanoma all the time. Sometimes activities that once used to be pleasant are no longer so. Feeling overwhelmed or distressed by your feelings. Changes in behaviors, perhaps avoiding doing skin checks, going to the doctor, or doing them too much. Difficulty falling asleep as the brain is finding it difficult to switch off. And it's okay not being able to sleep the night or two before a scan or doctor's appointment, but regular difficulty falling asleep may be concerning. And lastly, sometimes people use excessive drinking, drugs, or even watching Netflix to zone out. If it's done to excess, it might be a sign of concern. I will conclude this presentation by sharing a few tips that other patients with melanoma have found helpful in coping with fear and anxiety. The first step is to recognize that you're anxious. We call this name it to tame it strategy. Also recognize that fear and anxiety are normal response to uncertainty. Ask yourself, what am I uncertain about? And remember that it's normal for your brain to go to the worst case scenario. Brain just wants to protect you. Oftentimes people come and see me worried that they cannot stop worrying despite trying. Sometimes when the threat is real and feels close by, it's impossible not to worry or be fearful. It's like me asking you to relax when there's a tiger at your doorstep. Speak up. A problem shared is a problem halved. Let significant others know how you're feeling and get in touch with other people with melanoma. Oftentimes you will learn that you're not alone in how you're feeling. Seek information from your medical team. They have very sophisticated ways of knowing your personalized risk of melanoma coming back, recurring, or progressing. They can also inform you about things to look out for if melanoma comes back or progresses. Be prepared with questions for your consultations. Adhere to the follow-up recommendations. Sometimes anxiety will want you to do scans more often or less often than recommended. The follow-up recommendations are based on evidence. It is always easier to cope when you have sufficient sleep, adequate nutrition, and your body got some movement. Doing things that you love will increase your capacity to cope when you're worried. Anxiety wants us to reduce uncertainty, and sometimes you may get an urge to search for information, for example, asking Dr. Google, or check your skin more often. As much as these strategies seem to initially reduce anxiety, in the long term, they will increase it, as absolute certainty cannot be found. And lastly, seek professional help. Your medical team will be able to provide referrals to suitable counsellor and psychologists. Otherwise, you can give Melanoma Patients Australia or the Cancer Council a call for referrals.